I want to welcome everyone to this research symposium on mental health and addictions that is being put on by the Institute for Clinical Evaluative Sciences. We're delighted to have such a great turnout, and especially to have so many of our key partners here to discuss what we'll be presenting today, which is of course the work of ICES staff and scientists in collaboration, close collaboration with our partners to understand the state of mental health and addictions in children and youth in Ontario. Less than 4 years ago, many of us gathered in a hall in the Ontario Legislature to announce the launch of the Mental Health and Addiction Research Program at ICES under the leadership of Dr. Paul Kurdyak, who's an ICES scientist and a researcher and clinician at CAMH. And we're delighted that you've all gathered with us today to participate in our second research symposium and the second Children and Youth Mental Health and Addictions Report Card, which present the results of really a number of years of work, both of data gathering, building partnerships, and analysis at ICES. As many of you know, ICES is a network comprised of a central hub in Toronto and satellites that are throughout southern Ontario at medical schools, and one opening soon at ICES North in Sudbury, at the Northern Ontario School of Medicine and Laurentian University and Health Sciences North Research Institute. And that network is comprised, of course, not just of those sites, but of the individuals, the staff, the researchers, the scientists, and our key partners that allow us to do the work that we do. The symposium objectives for today are to convey information and evidence about mental health outcomes and service delivery in Ontario, to understand the policy response to performance measurement, and to foster engagement between research, policy, and care sectors. And events like this, I think, are key to that engagement. The information and evidence you'll hear today will help us understand how mental illness and addictions vary across Ontario and who is at highest risk. And this evidence can be critical to shape better policy and better outcomes. But evidence will influence and inform policy most effectively when we work closely together with our key stakeholders and partners. And we have many of you here today from over 40 organizations representing researchers, policymakers from both federal ministries and provincial ministries, care providers from both the community-based sectors and hospital-based sectors, and many of you working with children, youth, and adults. And we also welcome our Indigenous partners joining us today, some of whom are here in person and more by live stream. For over 15 years, mental health and addictions has been established as a key priority in First Nations in Ontario. In the analyses we're discussing today, we will not be presenting Indigenous-specific mental health data. ICES has relationships and data governance agreements with Indigenous organizations that acknowledge the inherent rights of First Nations, Métis, and Inuit peoples to determine how data are used to tell their stories and heal their communities. Currently, ICES is working directly with the Métis Nation of Ontario to provide Métis-specific mental health indicators. In addition, we're working with First Nations communities and the Chiefs of Ontario to respond to research priorities set in February 2016 for the analysis of First Nations mental health data. We invited Grand Council Chief Madabe today to join us for this important release of the Mental Health and Addictions Report, but unfortunately, due to his schedule, he couldn't be here. But Chief Madabe wanted me to read a statement on behalf of the Chiefs of Ontario and as the chair of the Ontario Chiefs Committee on Health. Mental health and addictions has been identified as one of the priorities of the Ontario Chiefs in Assembly, and we know it is a serious issue in our communities. We are currently working in partnership with the Institute for Clinical Evaluative Sciences to isolate data and support the work on mental health. I want to acknowledge the work we have done and the partnership we have built with the Institute. The Chiefs of Ontario also recognize and acknowledge the commitment of the Board of Directors in making First Nations research as one of their priorities. This partnership has resulted in trust and respect in the work we do together. The Chiefs of Ontario continue to look forward to a strong working relationship with the Institute for Clinical Evaluative Sciences. I want to thank Grand Chief Madabe for that statement. I think it's a great testament to the partnerships that we've built, not just with First Nations leadership, but also with the Métis Nation of Ontario, and as well our work with Inuit leadership organizations in Ontario. And so, on to the main proceedings. Just a couple of housekeeping notes. We are live tweeting this event, so if you'd like to join the conversation, we invite you to do so. And just remember to tweet at ICES Ontario. And if you do have questions, Dr. Bell has agreed to take some of your questions at the end of his statements, and then after we're going to have a panel session and there'll be a formal opportunity for questions. So it gives me great pleasure to welcome and introduce Dr. Bob Bell for his keynote address. Dr. Bell was appointed Deputy Minister of Health and Long-Term Care in June of 2014, and prior to that, as many of you know, he served as Chief Executive Officer of the UHN University Health Network for 9 years. Dr. Bell received his Doctor of Medicine from McGill and a Master of Science from the U of T, and studied also at the Mass General and at Harvard. Dr. Bell brings over 40 years of health experience to his current role. I should note he started when he was 10. But just as important, he brings boundless energy, immense skill, and an ever-present smile, and I think that really does make him unique in my experience among Deputy Ministers of Health in Ontario. Bob.
Thanks very much, Mike, and the smile is evidence of the effectiveness of continued behavioral therapy that's been part of my... So, good morning, everybody, and thank you, Dr. Schull, for the opportunity to be here this morning. This is an important part of our Patients First strategy, the development of an integrated approach to mental health and addictions within the Ontario health community. We're delighted to help you celebrate the launch of ICES's report on children and youth mental health scorecard, as well as the launch of the adult mental health scorecard. And I want to talk about 4 platforms that I think are extraordinarily important. And the first platform is the Ontario First Nations Action Plan, and the recognition that youth suicidality, the recognition of chronic disease, bears such remarkable attachment to the history of intergenerational trauma and colonialism that our Indigenous folks in Ontario have experienced, and the recognition that any approach to therapy must be informed by that experience. Certainly, that platform, which is ongoing, it speaks to the organization of primary care services and mental health services with Indigenous Ontarians, must be informed by that history and will continue to engage Indigenous Ontarians in the design of the models and the design of the platforms. The second platform I want to speak to is the Patients First platform, which, of course, Minister Hoskins introduced through a discussion paper about 18 months ago, and the Patients First Act now having been passed. And the Patients First Act really deals with the organization of care and the experience of care that Ontarians have in that retail part of our health system. Not in our hospitals, not in our acute care facilities, not in our cardiac networks, renal networks, or our cancer systems, but rather in that part of the Ontario health system that Ontarians tell us is difficult to navigate, and that frequently, when they finally find the door, they find there's no care behind that door. And that part of our system involves primary care, it involves the social aspects of health care related to home and community care, and critically it relates to mental health and addictions care. And the linkage under the model of a patient-centered medical home where a primary care provider, be it a nurse practitioner or a primary care physician, working within a comprehensive care model, we feel needs to be the future of the Patients First healthcare system in Ontario. And organized into organic units that are called right now geographically LIN sub-regions, but probably need to be better described as care communities. Communities in which communities of practice will thrive, based on relationship-driven care with a primary care provider and the essential knowledge the primary care provider has around navigation of the social services that patients require, and certainly of the mental health and addiction services that are required by their patients. And we set ourselves a challenge in the design of our programs, and that, of course, 2 ministries are responsible for mental health and addiction services. The Ministry Child and Youth Services as well as the Ministry of Health. Talking to Kim Moran earlier, I just said, you know, this is a reality that we simply have to face. It can't be an ongoing excuse. It needs to be something that we evolve within this care community model so that we're not tripping over the fact that there are two ministries involved here, that we simply break through that obstacle and anticipate that we can find access for patients better. The third platform that I want to mention is the one that's led by Susan Pickett, who's here today. Susan, thank you so much for your leadership of the Mental Health and Addictions Leadership Advisory Council to our minister. You've worked very hard. Your team's worked very hard. You've taught our ministry so much in the brief period of time that your council has been providing advice. And we're slow learners in the ministry, but we do listen, Susan, and we've heard you. We've heard you around your three chief elements of advice, two of which are being discussed here today. The first is the evaluation of gaps of service, the so-called basket of service approach. And that's where we're very excited about the Patients First model, because that basket for some services, perhaps for inpatient mental health and addiction services, may be LHIN-based. For other services in the community, it may be related to this care community model, where we're anticipating that every community should probably have sufficiency, or at least a very concrete understanding of where children's and adult mental health services and addiction services exist. So certainly that advice about a basket of services is something that we're listening to carefully. And of course, the other element that we've heard from the Mental Health Council is the issue of data. And the third item is the issue of quality. And of course, those two are so tightly interlinked that in our system, until you have data, it's difficult to understand the quality issue. So we're delighted, thanks to Dr. Guttmann and her team, and to Dr. Kurdyak and his team, for starting us along this approach to scorecards, starting us along the course of measurable quantities, measurable outcomes, measurable wait times that we can rely on in making investments in our system. And some of those investments are starting to happen. You know, in February 2017 this year, Minister Hoskins, of course, announced an investment of $140 million over 3 years to fill critical service gaps related to a province-wide structured psychotherapy program, 9 integrated youth service hubs, and approximately 1,150 supportive housing units for adults with severe mental health and addictions problems. So, you know, the combination of a structured approach in the province, we hope going to be enhanced, I'm fairly confident will be enhanced by a federal investment directed toward mental health and addictions. Just came back from a federal, provincial, territorial conference of deputy ministers last week, where this was a key topic of conversation, not only the amount of money available, but also crucially, the development of indicators that will express two things: the amount of incremental services that provinces and territories provide, and crucially, the development of quality indicators that will allow us to measure the impact of incremental services on the mental health of Canadians. And, you know, I'm pretty sure that the work that you're leading here, Mike and Paul, is going to be really instructive in providing that Canadian focus to understand outcomes and how outcomes are impacted. So the fourth platform I want to reference is the digital health platform that has developed under Minister Hoskins' leadership, the development of a digital health council, in the sense that two things need to change. One is that we need to integrate the various sources of data that Ontario has access to. And secondly, we need to pivot around our focus on providing information that's available to clinicians, to administrators. Important that they have access to that information, but just as important, and if we're to be driven to provide better information, needs to be accessible to consumers, to patients. So that concept of a consumer's digital strategy is one that's really driving our ministry, and the appointment of a new chief digital officer for Ontario, who's just arrived from San Francisco, is really helping us to up our game in terms of the way that we will provide information about health services and about health service outcomes to Ontarians. When we look at the progress that's been made in providing integrated information at point of care to clinicians, and the progress that's been made by Sunnybrook Hospital in particularly with its development of MyChart and the accessibility that citizens have to their health information through MyChart, we're definitely making progress. Lab data, diagnostic imaging data, hospital data, increasingly drug data. So in the next 3 or 4 weeks, we'll bring a provincial drug repository resource into our Connected Ontario repository that'll provide all of narcotic information and all of publicly funded drug information to about 2/3 of the providers in Ontario, with expectation that that'll spread across the system over the next year. So, increasingly integrated information at point of care with access through patient portals for citizens is becoming a reality, but there's not a lot of information there related to mental health and addictions care. Those sources of data exist, the opportunities to connect them exist, and I think the community probably has the opportunity to leapfrog in a way, in that with the work that you've done with GAINS, with OCAN, with Interride Mental Health, you are creating more structured elements of data than are available in the rest of the health system. And if we can integrate through an integrated assessment record, through a variety of ways of making that structured information related to patient status, related to patient outcomes, accessible through our repositories, in the next couple of years, we may have something that gives you access to better data than anybody else in the system. That's not a promise, it's a hope, and I'll look forward to learning what's being presented here today in terms of thinking of how that's going to occur. So Dr. Schull asked if I'd be happy to listen to questions. I come to these kinds of meetings because I always learn more than I teach, so I'd be delighted to hear any response that you might have, whether what I've said rings true to you, and your advice as to how we can do better for your patients. So thank you, Michael, for the opportunity. Thanks to all of you here for your leadership, and look forward to any questions I can answer. Thank you very much.